This is my third or fourth video, and I'm going to be talking about treatment. So, after my manic episode, I eventually crashed and entered the worst depression I've ever had. And this was from last May until November, so 7 months. I was suicidal, considering jumping in front of a bus a couple of times, and had to have my friends do a few suicide watches and take away knives from me and all that fun stuff. I cried all the time. I struggled to graduate. I wanted to sleep through my own graduation ceremony and party, uh, and be alone instead of with people. And this is when people started noticing that I wasn't doing well again. So I got back into formal treatment. I got a therapist who, again, was not that helpful. But she introduced me to DBT, dialectical behavioral therapy, which was really helpful, and I'm still trying to work with it. It takes a lot of work, but it's really helpful for symptom management and um, distress tolerance and things like that, which is really important. She also referred me to a great psychiatrist who finally gave me a proper diagnosis of bipolar. I'm not sure whether it's one or two. He didn't really specify. I think he said it was bipolar NOS for now until he got to know me better. And I think he probably knows me better by now. So I just need to ask him whether it's one or two, but I'm not too concerned about it. Um, let's see. Yeah, but he's known me since I've had one, I think, manic episode. So I think I might be leaning towards bipolar 1 rather than 2. Anyway, so now I'm playing the Let's Search for the Right Med game, which is not going so well. I started on risperidone and that didn't work. So I tried Abilify, which I'm still on, but on a low dose because it's not really working either. It worked at first to pull me out of that depression, but it hasn't really helped with anxiety or sleep. So I'm also taking Lamictal, but that hasn't done anything. But I'm staying on it because it takes so long to titrate up that if I want to start it again, I might as well just stay on it, I guess. I think that's his reasoning. So since none of those are working, I recently tried Latuda, and that just turned me into a zombie and made me nauseous, and didn't actually help either. So now I'm starting to get pretty frustrated. The latest medicine that my psychiatrist is trying is called Safras, and we'll see how that works out. Um, right now, my main problems are not really depression or mania, but anxiety and sleep. I just don't sleep, and I'm anxious all of the time, especially around work. Um, like, as far as sleep goes, I'm doing this video at 6:30 in the morning and haven't slept all night, so there's an example. And my anxiety has been so out of control, especially around work. Um, I work as a CNA, which is a certified nursing assistant at a nursing home for the elderly, and I worry all the time about people dying on me, getting yelled at by nurses or by coworkers, and dropping people from the machines that lift them up from their beds to their chairs, which are terrifying machines. So it's just a really stressful job, and it's really my main goal right now is just to deal with the anxiety surrounding work and to get a regular sleep pattern going. So that's where I'm at with treatment and with medications and my psychiatrist and work and stress and all that good stuff. So that's all for my introduction and life story about bipolar so far, and I'll move into more specific topics after this. Thanks for watching.